Welcome back to Medical Monday. We're talking about getting your feet to be healthy and happy and feel good. Dr. Matthew Newhouse is in here from Newhouse Foot and Ankle. Thank you for being here. We're getting lots of calls, and that tells me that a lot of people have foot trouble that they would like to get rid of. And we have two callers on the line I'd like to get to. Sally Ann is with us tonight. Hi, Sally Ann.
Hello.
Thank you for your patience. What's your question?
Well, I have a toenail on just one of my foot that it's like a hard rock, and it seems like it keeps getting bigger and bigger. My husband tries to file it down for me, and it's really, it hurts at times because it's so high up.
Okay.
And I don't understand what it is or why I even get that.
Yeah, good question. What do you think?
Well, you may have a fungus in there. That's the most likely cause, is toenail fungus. Sometimes people damage their toenail. If she's injured it over the years, it'll just grow up rather than out.
Right, that's what it's doing, is growing up rather than out.
Yeah, so it's probably damage to the root of the nail. And you can go in and any podiatrist can file that down for you and get it comfortable, or you can have it removed if you've got good blood flow to that toe, where you just don't ever have to worry about it doing that ever again. You can have it permanently fixed.
Oh, so she should have it probably maybe permanently removed?
I would go get it looked at, and that's an option.
Okay.
You can have it trimmed down every once in a while, once a year. I mean, they're not going to grow fast.
Okay.
Yeah, well, I don't know if I want to have it pulled off, because that's probably going to be very painful.
It's not as painful as you think. It really isn't. It's all that nail that's growing up is dead tissue, so you can clip that away, and it just feels better. And you know, if you permanently remove it, that doesn't hurt to have it removed. It'll just keep it from coming back. But those are the options: either have it trimmed down or have it permanently fixed.
So you think it was caused by a fungus, though?
Well, it's either a fungus or trauma. Those are the two things that will cause something like that.
Okay.
Well, Sally Ann, we're going to give you the name and number here at the end of the show, so get your pen and paper ready.
Okay.
And maybe you can get this fixed once and for all. But you have a good husband for filing that down. Isn't that nice?
Yeah,
That's a good husband.
I do.
Thank you for your call. I appreciate it. Okay, let's talk to Lisa. She's on the line waiting ever so patiently. Hi, Lisa.
Hi.
Go ahead.
I have a question. Like, my grandmama's toenails are brown, and then they grow so long, and then they'll curl over, like under her big toe. And then when you try to clean it, it hurts because it's got, like, I guess it must be dead skin or something.
Okay, any tips?
That sounds like the same type of thing. That's most likely a toenail fungus that's causing that. So I'd say get in and see your doctor, come to our office, see us, see a podiatrist that can assess that and tell you if it is indeed a fungus, and get you some treatment for that.
Okay, thank you, Lisa. Good luck with that. Ron is also on the line for us tonight. Ron, what's your question?
I was wondering what causes spurs in your feet. I broke my leg a long time ago, and I was trying to figure out, is that what caused a spur in your feet, like a corn on the bottom of your feet, because you're real sore and tender?
Yeah, so bone spurs are caused from abnormal pressure. Something is pulling on the bone, causing it to form a bone spur. Bone spurs in and of themselves typically don't cause pain. What causes pain is the soft tissue that's attached to the bone there that's pulling, that's tight. So a lot of people will see have heel spurs, but we can make that pain go away without doing anything to the bone spur. Now when you get a corn on your toe, which is a hard callus, hard tissue, sometimes that is caused from a bone spur that needs to be removed, and that's the only way to fix that. Trauma can do it. He said he had a leg injury. If you have a fracture, sometimes the bone overheals and will grow extra bone, and you'll get a spur that way. But typically what we see when people talk about spurs, it's heel spurs on the bottom of the foot that is caused from a tight plantar fascia and tight musculature on the bottom of the foot. Sometimes it's a tendon that pulls on the bone, and the bone just grows up into that structure.
Okay, Ron. So your tip for Ron, what should he do?
I'd probably go get it checked out, because it's not as simple as a heel spur. Get an X-ray and get an evaluation, and most people can have that pain go away. If that's pain in the bottom of your foot in the morning when you get out of bed, go from sitting to standing, that pain can go away. We can fix that pretty easy.
Well, that's good news. All right, Ron, good luck with that. Thank you for your call tonight. Hopefully that helps you just a bit. I do want to talk about ingrown toenails. I imagine this is a pretty common ailment. What causes them? What can you do?
Yeah, ingrown toenails are very common. Sometimes it's just cutting the toenail wrong. Sometimes it's genetics of having a wide toe. A lot of things can lead to ingrown toenails. But what people don't realize is ingrown toenails can be fixed forever. A lot of people just do their bathroom surgery once a week. They go to the bathroom and get the clippers out and just fight through it and cut it way back. That doesn't need to be done. There's a simple procedure we do in the office. We numb the toe up, cut just a sliver of nail on the edge, and take out that piece that's down underneath the skin, put a little chemical on it, and fix it forever. And it doesn't ever come back. It grows a nice straight edge. Again, on my YouTube channel, that was the very first video I ever did. And I go through it step by step. I show you exactly how to do it. If you want to try it at home, if you have the right instruments, you could do it watching my video.
No.
But really, it's a great procedure, and most people don't realize how easy it is to fix them. And it's not super painful. We don't give pain medicine after you have the procedure. People just feel better when it's fixed, and knowing that it doesn't ever have to come back. It's very rare. I call it my 98% procedure. It's very rare that I have anybody with problems or a regrowth of the nail.
Gotcha. Okay, so many people get pedicures these days. So many people. You have any pet peeves when it comes to what's happening there?
Well, the thing I always tell people with pedicures is make sure they clean their instruments appropriately. Some of these places will soak their instruments in this liquid, and they're super busy. There's a certain time period the instrument has to be in there before it's clean. And if they're really busy, they're not cleaning the tubs right, they're not using the instruments that are clean, they're treating people that have a nail fungus or an athlete's foot, and they can spread those diseases. Sometimes they'll cause an ingrown toenail by scraping or cutting too deeply. You know, there's a lot of issues that we see from pedicures, believe it or not.
Oh, I believe it. Yeah. Okay, so be careful where you choose to go, I guess is what you're saying.
Yep. In fact, a few years ago we started a nail spa in our office.
Oh, that's a good idea.
So we have a lady that works there. She has 2 chairs, 2 manicure tables, 2 pedicure chairs. We've got a couple ladies that work there, and they are trained what to look for. They clean their instruments with our autoclave, which is the hospital sterilization method. So they use clean instruments for every patient, and they do a really good job at making sure that people don't have problems. And if they do have a concern, we're across the hall, so they send them right over and we talk about it.
That was a genius idea. All right, before we have to go, I want to get in Ray real quick. Ray, we're kind of against the time clock, so if you can answer your question quickly, that'd be great. Ray, are you with me?
Yes.
Okay, go ahead.
Okay. To describe my wife's problem, like I said, she has very thin padding under her, on the bottom of both feet. She has what they call a spur or a seed within her feet, and she'll try to pick it out. But like I said, the doctor said that they could try breaking her feet to reset her bones, but that doesn't solve the problem of her having the thin sole or thin skin on both of her feet, which is really what the doctor says that they really cannot resolve.
Does this make sense to you?
It does, yeah. Some people will lose the fat pad. They get what's called fat pad atrophy. We should all have a certain amount of fat on the ball of the foot and on the heel. And as we age, some people will lose that fat, and they will be walking on bones. People that have rheumatoid arthritis will develop this condition where they just literally walk on the bones, and it really hurts. So sometimes we actually do surgery to adjust the bone or remove the part of the bone. And it's hard to say exactly what's going on here without an x-ray and seeing the patient, but losing the fat on the ball of the foot certainly does happen.
Okay. Gosh, I hate to hear that, Ray. Thank you for calling in. Again, everyone grab your pen and paper. When we come back, we're going to be giving you the email address and also a number to make an appointment, so stay with us. We're coming right back.